First supplies we need to bring in are food related. So Yunusef really focuses on the nutritional aspects, so it's therapeutic foods and supplementary foods. But obviously, it's a drought situation, so anything we can do to make sure communities have access to water, so water trucks, but also, portable water containers so that families can bring water to their homes. And then also during this period when kids get so under malnourished, then they're more susceptible to diseases and whatnot. So now we need to start doing some immunization, in particular like measles, but also have emergency health kits available, just because, when you're in the state of severe acute malnutrition, you need medical care. We also need to bring in kind of educational and play supplies for displaced kids, so whether they're displaced in their country or in a refugee camp. I'm trying to create some normalcy, so as we get them healthier, create environments for them to play and also, psychosocial support. It's huge drought levels. It hasn't been such drought in 20 years, so the quantities that we need to bring in are really big. In terms of supplemental and therapeutic food, it's unprecedented quantities for Yunusef. And so we're working with all the suppliers that we have. There's some locally in the Nairobi area that we're working with, but obviously the big quantities are coming from India and Europe. The real challenge there is getting it here fast enough. So, usually we'd put it on ships and it would take 20 to 40 days to get it to the Mombasa port, and then we've got to truck it into the different locations, which takes, again, another couple of weeks. So we're really trying to get this moved via air, which is, of course, very expensive. We're fortunate to have some airlines donating some cargo space, but the real challenge is getting the supplies that are available to the communities. To move what we want to move for the first month, we're looking at somewhere between $3 and $4 million just in logistics transport. So, and that's the early movements we need to move by air, and meanwhile we also start the movements by sea, so then it can be less expensive. But it's a lot of detailed planning and finding out, working with basically all the different cargoes, with trucks, with sea, and with air, and getting good rates and seeing what we can get contributed, and then also getting the donor money to support that. The most amount of affected people are in Somalia, but you've got people affected in northern Kenya, in Ethiopia. Of course, the drought hit the whole Horn of Africa, so potentially we're looking at what needs do we need to support in Djibouti. Eritrea seems okay, but it is really at scale. Again, the most hardest hit is Somalia, but you also have Somalis who are moving into Kenya to try to get support there. So we've got people across border that need to be supported. So it's really massive, and it's multi-state. Yunusef has programs in all these countries already, and a part of our programs is delivering particularly supplies, for example, for Child Health Days. And so we have already, supplies going in, but we also have pre-positioned supplies. So there's a fantastic warehouse stock that we have in Nairobi that we've been able to use and to deliver basically within 24 hours. We were able to pull on that stock. We also have warehouses in Dubai and in Copenhagen and different locations that we're drawing on. So again, the more local supplies we're able to move in quicker. The other ones, it's just a matter of time on getting them here. But we're really lucky that we have routes that we already work with, and we know what the supplies are. It's just needing to get them into the people.